listening to Evergreen Media Network. I am Cindy Schwartz. This is the Patient Partner Show. We are also podcast on Spreaker, so look us up on that. Jeannie Roller and I are talking about medical issues today. Jeannie, you have another good topic. Jeannie's got the one that's got all the topics, so I applaud you for the work that you do for this, Jeannie. I really thank you. And we have so many people that tell us, please keep doing this because it's happening all over the place and we don't want to feel like, the Lone Ranger, because both you and I did, Jeannie. I mean, I know I did, and we met through Misty Roberts. I shout out to her because she's been working on this for years, too. With the PTSD, whatever you want to describe it, horror that medical patients, how we were treated, and just couldn't believe it when we blindly trusted. And so the topic today is apropos for that, because you and I filled out so many of these things and we found out really that I know, basically didn't go anywhere. I don't want to sound paranoid and say, why did you really have me fill this out when it didn't go anywhere, because it seemingly didn't. I don't know if they ripped it up or what they did with it, but it didn't help me. And we're talking about surveys is what it is when you get and it's continual now. I want to say that 5 minutes, seemingly, when I walk out of a doctor's appointment, I have something in an email that says, please rate our service and blah, 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 blah. So I don't know what it's all about, because I know that I, in specifics, wrote, and I'm not going to mention any names, but specific details of what actually happened. And it went immediately to risk management, who told me everything that I was saying basically was a lie, that it never happened in their facility. No way would they ever do anything like that. Nobody that they employ do things like that. It's like I was on cloud 9 making all this stuff up just because I didn't have anything better to do that with day. And that's seemingly how my surveys went with the places that I went to, the Orlando hospital that it happened in, and with different other entities that, oh, please do this because we follow up with everything. And I'm not going to name the major outfits that send these to you, that didn't do anything, in my opinion. I mean, I didn't see anything getting done. In fact, I always felt bad that maybe if I named a person here and there that was trying to help me, I was hoping that they didn't get any repercussion from it, because they were trying to help me. And so let's talk about that, Jeannie. I mean, these surveys that they send you, I just don't know if it's a dead-end letter file or what it is, but I really don't see anything getting done with it in any situation that I've been in.
Yeah. Well, I mean, there are different surveys. My husband got a survey from the famous hospital survey company, and they asked to me really dumb questions like, was your dinner good? Well, who cares?
Yeah, that was part of the ones that I've done too. I mean, seriously. Okay, I mean, it matters. It matters. But I mean, when they're hustling you out of there, in a day and a half or 2 days, even with serious surgery, I mean, can you choke down a hot dog or some, cold fish or whatever they're giving you? Okay, what's the big deal with that?
Yeah. I mean, they really didn't ask the questions that matter. I know now that CMS, Center for Medicare and Medicaid Services, they have a survey. It's the HCA-HPS, Hospital Consumer Assessment of Healthcare Providers and Systems, that they also give. They ask questions too, like during this hospital stay, how often did the nurses treat you with courtesy and respect?
Right.
Now, the trouble with these kinds of questions is, it's like a rate on a scale of 1 to 10.
Mm-hmm.
To me, it would be better served if they were open-ended, or they gave a place to write down what you needed to say rather than just wanting a number. Because, Cindy, it's like with when a nurse comes in to change your gown and she just ripped it off of you and put another one on. That's not the way a gown is supposed to be changed. Really, they should never see your body while they're changing a gown, because there is a way that they are taught to do it. So if a nurse did that to you, then that meant the nurse didn't respect you. But where can you put that at? That some nurses did this. So interrupt you just for a second, Jeannie. A lot of the surveys that I've taken, because I don't really do them much any longer, they did have spots there.
They had
Did
spots
they?
where they had like an open place in the end. So I have to say that I have seen that in a bunch of the surveys.
Yeah.
I'm thinking Press Ganey is one of them. I know Cleveland Clinic sends out surveys, and there are open spots where you can write different things like that. And I've been specific. I'm like you. I've been
Right.
specific. I want them to know exactly, and the person that was doing it. Because it's not the
Yeah.
whole staff. I don't want that. There's a lot of great medical people out there. And I don't want them to be in the same arena with some of these other ones that I've seen that shouldn't be in the arena, if you will.
Right. When my husband had his Press Ganey, there was no place to specifically write anything. There
Okay.
were open areas, which yes, we did write in, but there wasn't a specific other or an open area to write it in. Because really, I don't think they want to know comments. They just want the numbers because they can put the numbers into a computer program and come up with the scores.
Oh, a data
And,
bank, yeah. Mm-hmm.
Yeah, yeah.
And of
that's
course,
how,
these are
you
our
know,
opinions, too. I just want to throw that out. I mean, from what I've seen and you've
Yeah.
seen, Jeannie. Yeah, go ahead. I interrupted you. Go ahead.
Well, and like CMS is looking for way. I think a lot of this with CMS has to do with how they rate hospital systems and
Oh, okay.
maybe even the way that they give bonuses to hospital systems. They're looking for that kind of stuff. Um, but there again, a lot of these questions you can't really say, yes, no, 1, 2. It because some nurses may treat you well, and other nurses may not. One doctor may have listened, one doctor may not have. So, I mean, I think that these surveys need to take into account that not everything is just a nice, tidy little answer.
Well,
And
that lends itself back to the whole thing. I mean, don't make me say it that, they really don't want to know what's happening. Seemingly, they really don't want to know what's happening because they're asking, closed-end questions on a scale of 1 to 6. Was your, come on, seriously? Kind of thing. Yeah, it's like in journalism, you don't want to you want to always ask open-ended questions. You don't want to ask a yes or no question unless you want to know yes or no specifically. Is the sky falling down, yes or no, kind of thing. But right, I mean, so ask the question. So it seemingly is that it's a data bank.
right, it is.
It's a data bank. Let's punch the numbers in there. Let's give the, a Nielsen rating, if you will, kind of thing in that arena. That's what it is. So, okay, we're going to give you this credibility score because blah, 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 blah. 60% of the people said, yeah, most of the time that the care was okay. Oh, we got, better care, blah, blah, blah. And it's really not true.
Right.
It's really not
And-
true.
Yeah. It is surprising. It's like, to me, it seems like they are wanting to appear that they care without really appearing that they care about your answer. Because I've heard some of these survey questions being done by phone, and, it was just very quick. This person who did the survey said, we just need this type of answer.
Mm-hmm.
So it was like, if you have something else to say, we really don't want to hear it. So,
Right.
yeah.
So why fill out the survey papers is what I say.
Right.
I mean, delete.
Right.
I mean, it's a waste of my time and my inbox to have to thread through all of these and delete. It takes time out of, my day to do that because I'm not going to fill it out because you simply don't do anything with it. Not from what my experience of it is. And I get it's a way to do so-and-so, but now if it's not going to be legitimate, then why bother? Because it doesn't seem like a lot of this is. I'm with you, especially the way some of the questions are worded. And certainly the way the answers are worded. I mean, on a scale of 1 to 10, okay, seriously? I don't know.
Right. Because, with somebody like me, I'm probably going to give most of it low ratings just for the fact that they don't give me the opportunity to say what, if there was an event that bothered me, they don't give me the place to say that.
Mm-hmm.
So I'm going to just have to rate the whole thing low in order to get my point across.
Yeah. On that note, not getting the opportunity as a patient, we stay tuned to Evergreen Media Network.